Welcome to the Real GI Doc Show. I'm your host, Dr. Fred Gandolfo, and I'm a board-certified gastroenterologist with a medical practice in New York. Today's episode is just going to be a reflection about 2024 and what kind of stuff happened in 2024. I'm going to talk a little bit about the show and a little bit about some current events that tie into basically everything that we do in medicine. And then I'm going to wrap it up at the end with a little bit of looking to the future. This episode will kind of be all over the place, and it's really just a wrap up to the year. So 2024 was the year of growth for my medical practice. Patient visits were up, procedure volume was up, and everything was getting busier in general. And that's a good thing, but it takes its toll on me, really, and the rest of the office, because we just have less time to do anything else. And at work more and more, the patient volume's going up, the hours are going up that I put in also, and the hours that I'm not spending time doing other things like, I don't know, being with my kids, being a dad, being a husband, having hobbies, and even working on the podcast. Everything kind of takes a hit when the office gets busy, but busyness, I guess, is a good thing in medicine because that's how we work. So hopefully in 2025, I'll figure out some more efficient ways to handle the volume, which is a good problem to have. So I'm not complaining, but just reflecting. And we started this show, or I keep saying we, like the royal we. I started this show in 2024, and this is episode now 32. And I missed 2 weeks, I have to confess. There were 2 weeks where I could not get a show out. But that's all right, because we got 32 episodes out in about half the year and did a pretty decent job in getting this stuff out to people every week. And I'm not sure if this is worthwhile to do it every week. I feel like it's a lot of episodes, and I'm not sure if people even listen to a third of them. So the fact that I keep pumping them out so quickly, maybe I should slow down and do one every other week. I'm not sure. We'll see how it goes in 2025. It's a lot of work to do this show every week, and I'm getting faster and more efficient at it. But then whenever that happens, I want to make it more interesting, and so it takes more work. And now I'm trying to do some video podcasts, so that takes a little more work too. So I feel like it gets a little better, but it just takes a little more work every time I do this. So I'm going to keep trying to make the show useful for everybody, and hopefully 2025 I'll find a better format to make this show more useful for more people. I'm still trying to find my voice out there in the podcasting world. And the exciting thing is I added this little studio space in my office to start doing some video recording. This episode, I just did not have time to even turn the camera on, but I wanted to get this out before the end of the year. But the truth is, I always wanted this show to be a video podcast. It's kind of cool to see the person who's behind the voice, and it's nice to be able to put this on YouTube or to send the little social clips out, because that's how people pay attention to what's going on. It's very hard to gain traction as a podcast alone, but when you have some video in there to make these little clips on Instagram, it's pretty cool. It gets a lot of hits that way and maybe spread some awareness about the show. And I thought it would be much harder to make the videos, but in fact, it's really not. It's I've had to release the OCD tendencies to edit every little imperfection out and all the little filler words out. When I'm doing the video, it's much harder to do that. So I just said, forget it. I'm not doing that anymore. So if you're going to hear some more raw stuff, and I'll mess up and I'll say some stupid filler words, and that's fine. That's just the way it is. And if you don't enjoy hearing those words, then I guess I'll give you a full refund of the price of the podcast. But that's it. I don't think I'm going to do every episode in video because it's monotonous, but it's once I get the angles and lights and everything fully nailed down, I'm still kind of playing around with that, then I'll be able to press record in the video camera a lot more easily. And that also means that I'm kind of ready to have some guests back on the show. I think now that we have the space and I've gotten it to a place where it's workable, 2025, we're going to see some guests on the show, which I'm really excited about because that's much more interesting than hearing my voice. And I get to hear some great different perspectives from my own, and that's what it's all about. So I'm psyched about that, and people that know me may get some invites soon, so say yes. Now, let's get into some more serious stuff about 2024 and healthcare. 2024 is a big year of uncertainty, or it was a big year of uncertainty, and I think the big thing in healthcare to talk about just happened. It was the murder of this United Healthcare executive Brian Thompson in the city just recently. And everyone knows the story. I don't have to rehash it. This is not like a true crime podcast. But this chief executive of United Healthcare, which is, I want to say, the biggest healthcare company in the country, he was killed in the city, walking to a conference or whatever it was. He was shot in the back by an assassin that they later caught in a McDonald's later on. And lots of people had mixed reactions to this killing. And I think, if someone gets gunned down in cold blood in the streets of New York City and wasn't involved in a gang or a crime or something like that, most of people's reactions are like shock and, oh my God, it's so sad. But this is the opposite. Lots of people felt that they were happy to see this money-grubbing healthcare executive get shot down in cold blood. And even though he wasn't doing anything at the time, he was just walking down the street with a cup of coffee or whatever it was. So that's not what you want to see in a civilized country. But a lot of people also were disgusted at the fact that other people were celebrating this guy's murder. And you had the internet exploding and news articles and everything like that, comments left and right saying that they're glad this guy died and making jokes about needing prior authorization for his funeral and all these things. And then people just being disgusted at that. And I think the majority, if you read through a lot of these comments and got the word on the street, was that the majority of people thought this killing was entertaining, or he deserved it, or it was something not worth worrying about or feeling bad about. And I think that's something that's worth kind of talking about, because it's, I don't know, it's human nature, or maybe it's a little surprising to some, but I feel like it's not that surprising, that kind of reaction. And people are saying, oh, the times are crazy, they're depraved, and everything is, all of society is out of whack right now. And I don't know if that's true. I think these kind of murders have been going on forever, as far back as human history. And I think this is a part of the human condition, which is when people are given extreme amounts of power and authority, and they use it to oppress other people, either literally to oppress them, or financially. And there's no checks and balances in the system. That is, the system's kind of working the way it's supposed to. And you have a few people who are amassing multi-millions or billions of dollars, and you have the masses who are relying on these people, and they get crushed, basically financially in this case. Then there's always someone who's going to take the matters into their own hand. Someone out in the street is going to take matters into their own hand and do something like this. And you can look back at examples from history: Julius Caesar, Caligula, Philip II of Macedon. So you have all these people who had massive amounts of power, yet they were killed in public settings, some of them. And there's a lot of stuff that goes into that. There's a lot of baggage that goes into this kind of a thing. And while I'm not saying that it's right to murder people in cold blood at all, it seems to be a historical pattern, and it seems to be more a part of humanity. And I don't know if I was really surprised when I heard about this. I don't think anyone should really be surprised. I think it's a little naive to be surprised that this kind of thing would happen. It doesn't mean you have to celebrate it, but at the same time, it doesn't really mean that it's so shocking that no one could have predicted something like this happening. And let's look at health insurance a little bit, because this is not really a podcast about this crime. And, it turns out they caught this guy, and he's just like another idiot with all the kinds of crazy conspiracy theories. But this is not really to focus on this guy's murder. It's really to talk about health insurance and how it's supposed to function. And, what's the purpose of health insurance? What's the purpose of any insurance, really? It's really to protect you against some type of financial loss. If you have an emergency or some type of sudden loss, you're supposed to pay a premium. You're supposed to pay into a system, and that money is there for you later in the form of insurance. So if you pay a lot of money into a premium and your house burns down, you get that money back and you can rebuild a house. That's the whole point of it. Not everyone is able to have a huge nest egg that they can rely on, but collectively, if you pool all that money together, that's insurance. Now, insurance for healthcare seems to be different. You pay a premium, which is very, very high. And if you need a service nowadays, your insurance company either pays the doctor or denies the claim and pays nothing. And there's a huge bureaucracy to support these claims being paid or denied, both at the insurance company and within healthcare systems. So you have these commercial hospitals and commercial large corporate systems that are employing the majority of doctors in the country, and they have a huge amount of administrators in their systems who are basically existing just to navigate health insurance and payments and make sure that the hospital is profitable, or at least doesn't go under. And what ends up happening is that a huge amount of these insurance payouts go to overhead, and they go to bureaucratic expenses that are required to deal with the insurance companies in the first place. So it's just like inflation baked right into the system. And you have a bunch of people who are not providing patient care, who are not caregivers. They're not doctors. They're not nurses. They're not the guy who pushes the stretcher down the hallway. They're not the guy who runs the x-ray machine or the respiratory therapist that comes to your bedside and gives you a nebulizer treatment. They're not those people. They're the people who are sitting in an office and just doing office stuff that has to do with healthcare. They could do that work anywhere. It doesn't need to be in healthcare. And these administrators, the ratio of administrators to doctors is not that there's one doctor per administrator or one administrator for 5 doctors. It's quite the opposite. There are roughly 10 administrators for every 1 doctor, which is crazy. So there's a 10-to-1 ratio of administrators to doctors. And this accounts for roughly 30% of total healthcare spending in this country. And these are estimates, and you can look all over the place and find different estimates, but these are the ones that I keep seeing when I'm looking around for this kind of stuff. And the current estimate for the percentage of healthcare spending in this country that actually goes toward doctors' salaries, so the people who are providing the care under their license, for the most part, doctors, 8.6%. So if this huge chunk of money is going into healthcare, the doctors, the greedy doctors who are making all this money, are getting 8.6% of it. And healthcare administrators and other people who are counting beans or pushing paper are getting 30% of this money. And that's crazy. That's totally crazy. Everything is backwards. So they say the average doctor salary in the US is somewhere around, and this is shocking to many, but that's $350,000 a year. And many doctors work 60 hours or 80 hours a week to make that money, as well as night call and weekend call and giving up their 20s and 30s and not having any social life and being worried about getting sued all the time and paying ridiculous amounts of malpractice insurance. But they're making that salary, which is well above what the average person makes, of course, but that's because they're dedicated to saving your life when you need them, and they have the expertise and the training and the sacrifices that make them able to do that. And according to a website called salary.com, the average hospital administrator salary is somewhere in the ballpark of $280,000 a year, and that can range to the $100,000s to $400,000. So anywhere between $100,000 and $400,000 a year. Now that's also a little bit insane, because many of these people work banker's hours and they have no night call and weekend call and late night responsibilities, and they're not getting sued by patients because they did something that they perceived was some type of medical error or something bad happened. They get to hide behind a desk somewhere and make decisions and make a lot of money. They didn't go to med school, they didn't go to residency, they were able to hang out with their friends and have a family life. And they also have no ability to provide health care. So we're giving away a lot of our money that the insurance companies are paying and that we're paying, basically, that people are paying. They're ending up in the pockets of administrators and not as much in the pockets of the people who are actually providing the health care, which are the doctors. So let's go back and look at the insurance industry for a minute. And let's look at United Healthcare, because that's where this guy was the chief executive of. It was United Healthcare, and they post their public company, they're a publicly traded company, so they post their profits and everything publicly, and the numbers are ridiculous. They are ridiculous. In this year, or in terms of like this year, how much data we have from the year ending on September 30th of 2024, based on the previous 12 months, their gross profit was $90 billion in a year. That's profit. That's gross profit. And if you look at their net profit, what they made out with at the end of the year, in 2023, we're talking about $22 billion, which is 11% higher than it was in 2022. In 2022, they made $20 billion in net income, which is 16.5% higher than they made in 2021, which was only $17 billion, a measly $17 billion, which is 12% higher than they made in 2020. So it seems like every year they increase their profits by over 10%, 11%, 12%, 16%. So every year they're getting more and more out of people. And how is that even possible? It's because they're charging for premiums and they're not paying for stuff. There's no real other way they can do that. And this is why people are angry. And I'm not saying that it's right to go and shoot a random guy in the street and get this executive. That's not the right answer. But this is why people are angry. Because they're siphoning off money. They've created this whole class of people that are necessary to deal with insurance companies, these healthcare administrators, that are just really there to make sure that the hospital gets paid and to maximize reimbursement for the hospital, because the insurance company is trying to stiff them and the hospital has to fight back, and then they just keep driving up the money and everyone has to suffer because of this. And the whole system is like racing to the bottom. Unless you're a healthcare executive, then it's racing to the top because you're making increased amounts of profits every year in the billion-dollar range, multi-billion-dollar range. And then what about doctors? So CMS, which is Medicare and Medicaid, they kind of set the tone for what people are going to get paid. And every year it changes a little bit. And every year they try to reduce the payments to doctors. And this year, they successfully, or in the 2025 year upcoming, they successfully were able to reduce the payments to physicians for everything by 2.8%. And every year they keep lowering, and every year they have a congressional rescue where they basically hold off on this decreased payment. But this year they did not have that issue. They were not able to fix this in the last minute. And there's a 2.8% decreased reimbursement coming our way in 2025 as the healthcare provider, the only person in the system that's actually providing under their medical license most of the healthcare. Now nurses have licenses too and all these things, but everyone kind of operates under the doctor in terms of, if there's no doctors, there's no hospitals. If there's no doctors, there's no prescriptions. If there's no doctors, there's no tests. There's no surgery, all that stuff. So everyone's operating under the doctor. All the healthcare dollars flowing in come in because the doctor exists and does his or her thing. So they're going to cut doctor pay by 2.8%, while insurance companies are allowed to post ridiculous profits that go up by 15% a year, roughly. It's just completely backwards. To add insult to injury, if you look at cost expenses for practices, they're estimated to increase next year by 3.6%. So if you add 3.6% to the 2.8% reduction, they're saying basically that there's going to be an effective cut of about 6.4% in physician payments. So do the same job next year, just get paid 6.4% less for it. So what's the take-home message here? Healthcare spending is out of control. There's a huge burden of administration, which is partially a waste, and the other part of it is necessary just to get paid by insurance companies because of all the ridiculous regulations. And to combat the ever-present denials of care, meaning that the doctor orders something and it's denied, and they appeal it and it's denied, and you have to get on the phone and speak with a random doctor from another state that doesn't even practice in your specialty, who calls themselves a peer, and then they deny it also. Or sometimes they give it to you. Who knows? But it just adds administrative burden and time. And for all that, the doctors will get paid less next year. So things seem to be getting worse in healthcare in 2025. It's going to be harder yet again for private doctors like myself to stay in business. It's a constant struggle. I feel like it's trying to plug a leaking ship and sail it across the ocean. We're working harder for less money. What this often leads to is some type of conveyor belt practice where the patients are in the office for 3 minutes and they're at the door. And everyone's frustrated. Patients are really frustrated. They're getting poor care. No one's listening. Doctors are frustrated because they're forced to see 6.4% patients next year, more than they had to the year before to make the same amount of money. And next year it'll be worse than that and worse than that. And it's just a race to the bottom. And that results in burnout. And more doctors leave the workforce by early retirement, non-clinical jobs, suicide, and any other way out of this field. And even more importantly, some of the smarter people in the world are not going into medicine anymore because they see the way the field is going and they don't want in at all. So we're losing docs and we're not going to be getting the best of the best in the field anymore because it is simply not worth it. So how did it get this way? I'm no expert in this, of course. I'm not a healthcare policy wonk, but I just kind of work in this world, so I feel these things happening in real time. But I feel like back in the crazy heyday of medicine, whenever that was, the 80s or something like that, doctors did crazy expensive tests, they abused the system, they billed whatever they wanted, and they got paid some ridiculous amount of money. And therefore regulations were a necessary evil because people were abusing the system, which is also human nature. But now the pendulum swung in the other direction, way too far. And now insurance companies are basically obstructing care and stealing premiums from patients and banking ridiculous profits. And people are shooting each other in the streets. So what can we do in 2025 to change this? Well, what can you do and what can I do? Probably nothing. This is going to be the way it's going to be for a while until something cracks. Who knows what that's going to be? But what kind of possible solutions could we come up with if we had a magic wand? And there's a million of them. But let's just talk about the ones that have to do with insurance and payments, because there's a million other things that can help with healthcare, like people taking care of themselves and people practicing preventive medicine and not making crazy lifestyle decisions and doctors doing a better job taking history and all these things. But if we're just going to talk about insurance and how things are paid for and all this madness, we could cap insurance company profits. They don't need to make whatever $22 billion in profit. How about $1 billion in profit? How about $2 billion in profit? Give the rest of the money back to people, lower their premiums, or pay for their care, perhaps. Maybe let them get their CAT scans or whatever else I spend half my day fighting with insurance companies for. We could also limit the need for this sea of administrators in medicine. We don't need all these administrators for everything. A lot of it's just wasteful and is sucking up 30% of the healthcare dollars. We could simplify the insurance payment regulations. We can start using insurance for major care like surgery or emergency care and not for the minor stuff like getting a flu shot or getting your blood drawn. Maybe these things can have reasonable cash rates and people can pay $8 for a blood draw and not send it through insurance and have to employ a person to do that and have to employ people at the insurance company to do that and have to spend $70 to get a blood draw. Although no one really pays that for blood draws. That was a bad example. But you get the gist of it. When your light bulb blows out in your kitchen, you don't go through homeowner's insurance, right? You just buy a light bulb at Home Depot for $2 and put it back in. And it's the same for healthcare. You should just pay $11 for, some antibiotic and not have to pay $800 for something and has to go through 3 different pharmacy cost-saving programs to get some antibiotic that probably costs $3 to make. It's all just wacky. What about switching to a single-payer system, a national healthcare system? Those are all options, and they all have flaws, but this system is not really working very well for anybody, except for the insurance executives. Well, I guess I don't have the answers. I'm just going to keep making podcasts and treating people the best way I can in a system that's fundamentally broken. But it's the only system that we have to work in right now in the good old US of A. So here I am, and here you'll be. And I'll see you in 2025 with hopefully some more upbeat episodes and upbeat talks, and maybe we'll talk about some cool GI stuff again, like nutrition and bowel habits and constipation and all kinds of fun stuff like that. I'm still waiting for that probiotic talk. I still have to do some reading on probiotics, but I want to talk about all this fun stuff in 2025 in the new studio space with a big smile on my face. And if the system's going down, at least you can watch it happen here on the Real GI Doc Show in 2025. All right. Hopefully this was a good one to listen to. Maybe it was a little ridiculous. I didn't really know where I was going with this when I started it, and it went to a dark place. But it's reality. This is the frustrating system that we have to practice in as physicians. And if I could just see the patients and recommend good medical care, this would be such a cool field. But at the end of the day, I spend most of my time writing a note for an insurance company, so I'll get paid for my effort. And if that note isn't perfect, they'll deny something. And then we got to get on the phone, and then the cycle of madness begins. And then the patient's calling about their drug that wasn't authorized, and their CAT scan that needs an authorization, and their endoscopy that the insurance company won't authorize, even though they meet all the medical criteria. So that's just the way it works over here. All right, if you like it, follow me on social media at RealGIDoc. You can also leave me a question using the link below in the show notes. And I do like to answer listener questions on the show. So please leave me some interesting questions about gastroenterology topics or whatever. Happy New Year, everybody.
That's it for this episode of The Real GI Doc Show. Make sure to join Dr. Gandolfo next time to explore another interesting topic in gastrointestinal health. And remember, the views and opinions presented in today's episode are for informational and entertainment purposes only. Nothing discussed in this episode should be considered or used as a substitute for medical advice, diagnosis, or treatment. If you're experiencing a health issue, please consult with a doctor or a medical provider in your area. Thanks again for listening to the show.